Hi, my name is Vanessa Perez and I am a student at Point Loma Nazarene University. My study is on the effective reading of a reading intervention program on the reading achievement and task completion of high school students with IEPs. The purpose of this study is to determine whether implementing a reading intervention program will increase task completion and reading achievement of 10th and 11th grade high school students with IEPs. The significance of the study is to improve reading levels of struggling high school students with IEPs. If proved to work, this suggested reading intervention should be used for a tool for struggling readers, specifically those with IEPs. The research questions I have are: what is the effect of a reading intervention program on the reading achievement of high school students with IEPs? And what is the effect of a reading intervention program on task completion? First, regarding motivation, there have been studies to show that there's a steady decline in students' attitudes toward academic and pleasure reading as they move up in grade level. This is especially apparent with students who have disabilities and who struggle gaining access to content knowledge. Roberts also studied that the 5 areas that are critical to reading improvement are also the areas of struggle for students with learning disabilities. Yang studied that Yang researched that there are 2 different types of motivation: integrated motivation and instrumental motivation. Regarding reading intervention programs, it has been shown that repeated reading and wide reading practices for students who have severe reading difficulties has been shown to significantly help struggling students. There are also approaches to teaching phonics and syllable word patterns that Gunning had researched for reading intervention programs and he used in the classroom. And also there are metacognitive awareness reading strategy techniques, specifically with English language learners. Lastly, teacher training and attitude. Generally, high school teachers do not see reading instruction as their responsibility. Teachers typically are affected by their own beliefs of student learning, and they do not implement recommended practices and procedures with high fidelity when they're initially trained. They typically revert back to their own practices and believe that students should already have the knowledge and foundational skills of how to read. The type of study I am conducting is a quantitative study, which I will gather data on student reading achievement and task completion. The subjects that I will be studying are from a WASC accredited 9th through 12th grade charter school. They are all primarily English language learners. There will be 23 students, 11 10th grade students, and 12 11th grade students. And all of these students have IEPs or individualized education programs. A little bit of the breakdown of the population and of these students are: one student has autism, one has traumatic brain injury or TBI, and one student has other health impairment. There are 20 students with specific learning disability, in particular 4 with auditory processing, 4 with visual processing, 3 with auditory and visual processing, 3 with auditory processing and short-term memory, 1 ADHD, 1 ADHD and auditory processing, 2 cognitive disorders, and 2 students with expressive and receptive language. So the subjects also, there are 10 Hispanic males, 11 Hispanic females, and 2 African American males. What I'll be doing and how I'll be collecting information, analyzing this study are regarding task completion. There will be weekly progress reports in both English and history with assignments that are listed for this teachers to fill out each week. And we will be comparing weekly task completion from progress reports, which will be pulled from PowerSchool, which is an online database tracker for the students' grades. So these will be pulled during week 1 and week 6, and I'll be comparing grade percentages from week 1 and week 6 to see if there is any difference. Regarding reading achievement in the 6-week study, There is going to be a reading intervention program that is going to be applied 4 times per week for 30 minutes, and this is going to be all students. These students will be pulled out of the regular classroom setting to attend these sessions 4 times a week. Baseline data that is going to be collected is going to be during week 1 to determine their Lexile level, and also during week 6 to see if their Lexile level has increased, decreased, or stayed the same. And also data is going to be collected weekly with the fluency chart and comprehension questions. Along with all these students, I'm going to pull a second, I'll create a second study group with 11 of the 23 students, and they will have an additional 20 minutes per week and more teacher-led instruction. Ethical considerations that are regarding this study are confidentiality and protecting students' information. Your data is going to be kept out of sight. They will not be able to access it. This data or this study is not going to harm students in any way. Nothing dangerous is going to be going on, just the confidentiality and keeping their names confidential. Some limitations of the study are it's a small sample size. I only have 23 students that I'm able to test at this particular time, and it is a low socioeconomic status, and a lot of these students have very poor attendance, so getting them to actually fulfill the full 6 weeks, 4 days a week is going to be difficult. And also only students with IEPs will be studied. And some of these students do receive additional support outside of the study in regards to tutoring.